Listen, what we're talking about today may just shift how you survive the next year of nursing. Now, you're likely recognizing that building resilience and self-care tips do not fix burnout. Now, I understand that's what all the articles and the gurus are telling you to do, but telling you to do a 5-minute meditation to solve your burnout is like putting a Band-Aid on a gaping, gushing wound. Because burnout is not the actual problem. It's the symptoms. Listen to that again. It's the symptoms. Burnout is your body and mind's response to the problem, not the actual problem itself. The problem is you're trapped in a broken healthcare system and you feel misaligned. Now, as you know, a Band-Aid attempt of a solution doesn't work. So trying to alleviate the symptoms, burnout, without tackling the cause will get you essentially nowhere. But there is a solution that focuses on the cause. Nurses across the country are pulling themselves out of the trenches by getting back to why they went into nursing to begin with. They're doing nursing on their own terms, using their skills and experience to work with who they love and solving existing problems. Think of it as gaps they've seen in the system. Now, all of those gaps are simply problems, which means they're also opportunities to create a solution. And nurses are solving them by becoming consultants, creating courses and coaches. As a nurse, you have the unique insight of what I call a dual user experience. Now, everyone knows that nurses spend by far the most time with patients and their caregivers. The number of hours we spend with patients obliterates the minutes spent by any other healthcare professional. And we also understand the provider side, which means we know how the system works, as well as where it doesn't work. In fact, we see the gaps in the system every day we go to work, which means nurses are uniquely positioned to create solutions to the existing problems in healthcare. So you can continue to think that burnout is the problem and deep breathe all you want, but sooner than later, you're going to realize that gaping, gushing wound isn't slowing down with your Band-Aid solution. Now, it's up to you to decide whether you stay trapped in the deep, dark pit of exhaustion and burnout and being misaligned with your work, or you can make the choice to get back to doing what you love, increase your impact, and be valued for your work, all while staying in nursing. Now, if the latter resonates with you, then consider yourself part of the RN uprising and join me and the other dedicated, purpose-driven nurses making their impact. I'd love to hear from you. And have you tried the self-care route only to have a few minutes of relief that is essentially erased during the next day at work? I know a lot of nurses have. Now remember, as the largest percentage of the healthcare workforce, we are in this together. So comment below so your voice is heard. I'm Jill Weberding, CEO and founder of Nurse Assure, a consulting business, and the creator of the Nurse Consultant Collaborative. And if you found this content helpful, make sure you like, share, and subscribe so that you stay in the loop of what's happening now with nurses in business.